Can you imagine being told that you have high blood pressure when you were just a young teenager, and now that you would have to take not only one, but three antihypertensive medications every day for the rest of your life? And despite following your strict advice from your doctor, your blood pressure never seems to get better. That was the story of our patient, a 28-year-old accountant who's been struggling with hypertension all his life. He's been to multiple hospitals, multiple clinics, religious based healing centers, and even traditional healers, but nothing seems to work. Hi, my name is Dr. Abdi Dandena. I am the head of radiology at Saifee Hospital, Tanzania, and the following story is based on a remarkable case I encountered while working in the southern parts of Ethiopia. So, my first introduction to this case was actually quite routine. The patient came to our hospital with flu-like symptoms, which he contracted during a recent work trip. And he was initially evaluated by our GP. And after the clinical evaluations, a routine chest X-ray was ordered to exclude pneumonia. And this happens to be his chest X-ray. So on a first glance, the X-ray looks normal. The lungs are clear and there are no obvious signs of pneumonia. But when we look a bit closer, we see a very subtle but sinister finding. So when you look at the undersides of the ribs, there appears to be a subtle erosions in the inferior borders. That is an uncommon radiological sign known as rib notching, a finding which has been associated with rare neurologic as well as vascular disorders. By this time, we were not aware of his struggles with hypertension because this was his first visit to a hospital. So I, as the reporting radiologist, called the patient in and asked for some clinical history. And that's when we found out that he's been struggling with uncontrollable hypertension all his life. So, given this additional history, we decided to investigate further, suspecting that there might be a narrowing in his aorta, which is the main blood vessel connecting the heart to the rest of the body. So that narrowing would have explained his hypertension as well as his chest X-ray findings. So we decided to do a CT scan with angiogram. And this was his CT scan finding. And what we saw completely shocked us. Instead of the narrowing that we suspected, the aorta, a chunk of the aorta was missing, a condition which we will later discover to be known as interrupted aortic arch, an extremely rare disorder. This disorder is rare for a good reason, because it's actually incompatible with life, with most babies affected with this disorder usually dying within the first few days of life. And it is exceedingly rare to see that there is an adult patient walking among us. So there you have it. This was my case of interrupted aortic arch. So this is a powerful reminder that rare diseases do exist, and oftentimes they do not announce themselves. They usually hide for years and even decades behind failed treatments, misdiagnosis, and a lot of disappointment. And as radiologists, time and time again, we see that imaging can often be a key to these mysteries. So thank you all for listening, and thank you, Scientific Research, for platforming our story.